Good afternoon, everybody. I'm Christoph Heusgen, the German ambassador to the United Nations, and together with my colleague and friend Jose Singer from the Dominican Republic, we are very happy to host this meeting, this important meeting this afternoon. And I would like to give the floor to the beginning to the co-host, Jose Singer. Jose. You have to unmute.
Thank you, Christoph. Good afternoon. On behalf of the organizers, I would like to welcome all participants as well as those of you following via UN Web TV. Our special thanks to the distinguished panelists who will share their authoritative analysis and opinions on the current humanitarian situation in Venezuela, particularly amid COVID-19 pandemic. Distinguished participants, we are all coping with the devastating impacts of this pandemic, one that has taken the lives of more than 650,000 people around the world and infected over 16 million. It is testing the limits of the resilience of our people and our economies. It is impairing the livelihood of millions of our citizens, pushing many into acute poverty and erasing decades of improvements in human development. In such circumstances, it is hard to overcome the collective panic that pushes many towards nationalism. A global pandemic with multidimensional impacts requires a global response. Now more than ever, we need to keep the light of solidarity shining and our efforts united. And it is precisely in the spirit of solidarity towards the people of Venezuela that we are here today. Allow me to repeat in Spanish just to make very clear. Es precisamente en el espíritu de solidaridad con el pueblo venezolano la razón por la cual copatrocinamos este evento. It is our collective duty to discuss the impact of the pandemic on millions of its citizens, as an ill-equipped national healthcare system faces a potential avalanche of new cases. But most importantly, to discuss the possible venues to help the country overcome the many, many challenges it is facing due to the years of political and economic crisis. Such collapse threatens to exacerbate an already dire humanitarian situation in the country, force even more people to flee and contribute to the spread of the virus in the region. An urgent preventive response needs to be in place with the facilitation of the UN and with the Venezuelan people at the center. To give you just one example, now in the middle of this pandemic, of particular concern in the fate of millions of women, girls, and other vulnerable groups, we face increased violence, limited access to income, and social protection mechanisms. This has a devastating and multiplier effect, considering many are the main or only providers in their households. What will their fate if assistance, access to service, and dignified life are not provided? Most probably, they will have to embark on a journey to the unknown, as have millions of other Venezuelans. Therefore, a response based on unique realities on the ground and based on independent assessments with the necessary funding will be crucial to assist Venezuela through the very difficult times. I repeat, por tanto, una respuesta basada en las realidades propias sobre el terreno y basadas en evaluaciones independientes con el presupuesto apropiado será crucial para asistir a Venezuela. There are indeed many dimensions and perhaps limited options to the ongoing humanitarian crisis in Venezuela, greatly worsened by the pandemic. But we are lucky to have today with us three outstanding individuals who will help us better understand the scale of the situation and fuel our actions. I urge all to share their visions and perspective with neutral and impartial lens, so we can advance this conversation while avoiding its politicization. I repeat, les pido a todos a compartir su visión neutral con una óptica imparcial para que podamos avanzar el diálogo sin politizarlo. We commend the strategic collaboration between Johns Hopkins University and Human Rights Watch, leading the publication of a very comprehensive report of the humanitarian situation in the country. Through the assessment of its healthcare system, with findings we look forward to hearing more details this afternoon. We are encouraged by the recent agreement between the Venezuelan healthcare minister and the opposition-led National Assembly to work with the regional arm of the World Health Organization to combat the coronavirus pandemic. This is an important step. So, Christophe, I will stop here, and once again, welcome to all. Thank you.
Well, thank you very much, Jose, for this introduction and the remarks you made on the complex humanitarian emergency faced by the Venezuelan people today. I look forward to the discussion on how the international community can help and provide sufficient humanitarian assistance to the many in need. I'm pleased and honored to introduce today's panelists. First, Dr. Kathleen Page of Johns Hopkins University. Dr. Page is an associate professor of medicine at Johns Hopkins. Her areas of expertise include infectious diseases, HIV/AIDS, and tuberculosis. She's the co-founder of Centro Sol, which is developing novel strategies to meet the health needs of Latino migrants through research, education, and clinical care. She is a recipient of numerous awards, and in 2018, she was a Johns Hopkins School of Medicine 125th anniversary Living the Hopkins Mission honoree. Her most recent work with Human Rights Watch includes a report that assesses the impact of the COVID-19 pandemic on Venezuela's healthcare system. The second panelist is Selene Soto of Women's Link Worldwide. Ms. Soto is a Venezuelan lawyer. Prior to joining Women's Link Worldwide, she worked for over 7 years as a human rights specialist at the Inter-American Commission on Human Rights in Washington. She will focus her remarks on the effect of the COVID-19 pandemic on women, girls, and marginalized groups in Venezuela. And last but not least, Louis Charbonneau of Human Rights Watch. He is the United Nations Director at Human Rights Watch. Before joining HRW, he was a journalist for 2 decades and reported from dozens of countries all over the world. Now over to the panelists. Before Kathleen Page will introduce her remarks, she will show a short video. So over to you, Kathleen.
Doctors around the world are struggling to respond to COVID-19. We're working really hard and doing their very best to try to save as many lives as possible. Imagine trying to do this in a country where the health system has almost collapsed before COVID-19 even arrived.
That is exactly how healthcare workers in Venezuela are having to work. Water shortages in many public hospitals have meant patients and staff have to bring their own water for drinking, medical procedures, and of course, washing their hands, the main defense against the spread of COVID-19. Like many countries, face masks and gloves are also scarce, even in hospitals that have been designated officially for the COVID-19 response. But there are additional obstacles. Doctors and nurses we spoke to said that soap and disinfectants are virtually non-existent in their clinics and hospitals. And because inflation has risen in Venezuela and salaries have been devalued, it has become increasingly difficult for healthcare workers to buy their own supplies. The breakdown of the health system in Venezuela has created unsafe conditions for healthcare workers and patients. These conditions can increase the spread of COVID-19 and could lead to more deaths. The UN, US, the Lima Group, and the European Union should press Venezuelan authorities to urgently let UN humanitarian workers provide sufficient aid and help with healthcare to prevent the pandemic from spreading further.
Hello, everyone, and thank you very much, ambassadors, members of the council, and organizers for allowing me to present today. As mentioned, I am an infectious disease physician at Johns Hopkins, and I've been collaborating with Human Rights Watch, assessing the health situation and public health conditions for the last 2 years. Last year, we published a report with Human Rights Watch documenting collapsed healthcare infrastructure with dire consequences. At that time, there was an increase in vaccine-preventable diseases. Malaria cases had risen higher than in any other place in the world, at a rate higher than any other place in the world, and the situation was really quite severe. Last year, this decaying infrastructure was further exacerbated by shortages of water and electricity throughout the country. In December of last year, in 2019, we embarked on a research to assess the impact of these water shortages on hospital operations and health care. At that time, we interviewed clinicians, nurses, and doctors in different public hospitals in different states, and what we found was quite severe. We reviewed data and found that 70% of the hospitals had intermittent access to water, 20% had no water at all, and that the shortages were especially severe in the interior of the country. As you saw in the video, without access to water, hospitals really had limited capacity to care for patients. In many instances, even the emergency room had to turn people away who were in critical condition because there was no water for basic hospital operations. In addition, basic hospital hygiene protocols, including hand washing, which is so important to prevent hospital-acquired infections, were not being met. And providers, doctors and nurses had to bring their own water, buy their own supplies, soap and disinfectants, so that they could maintain basic hygiene. In addition, there was no water to flush toilets, to clean the hospital's rooms and operating rooms. And as a result, there was a significant increase in hospital-acquired infections that were documented even before COVID-19. Some examples that were really give a little bit of image of what was happening. Doctors were talking about a dentist situation where, for example, some doctors had to wash their hands from water dropping off from air conditionings before going to the operating room. Patients in some hospitals had to go and defecate outside because the hospital bathrooms did not have water to flush the toilets. In this context, COVID-19 emerged and really has been devastating throughout the world. The first 2 cases of COVID-19 were confirmed in Venezuela in March 13th. That month, a survey of over 1,000 healthcare workers in Venezuela was conducted, and at that time, 1/3 of the healthcare workers reported that there was no access to potable water in their hospitals, and 2/3 said that they had intermittent access. In addition, 76% of healthcare workers said they had no access to soap, and 57% said they had no access to gloves. As of today, there have been 16,571 COVID-19 cases confirmed in Venezuela. There's been a very concerning upward trend with a 3-fold increase in cases over the last month. The government has attributed a lot of the increased cases to returnees coming back to Venezuela from Colombia and other places. However, we must remember that 25% of Venezuelan households lack sustainable access to potable water, and under these conditions, community transmission is likely to occur. In addition, the government reports that there's been 151 deaths. That is actually a very low number of deaths given the number of confirmed cases, and it translates to a case fatality rate of 0.9%, which, as a point of comparison, is 4 times lower than the case fatality in the United States. The question is, how representative is this data to what's really happening on the ground? And given the conditions in the hospitals and the lack of capacity to provide complex care that preceded COVID-19, is it realistic to think that the mortality rate of this disease is so much lower in Venezuela than it is in other countries, including the US? To try to understand this question, we have continued to have conversations with providers and review some of the protocols that are being implemented in Venezuela to control COVID-19. What we're hearing is the following. Unfortunately, the shortages of water that were reported to us in December continue to happen. The shortages of PPE, personal protective equipment, and although many health providers know that there's been donations done, these have not necessarily reached all the hospitals and in all places. Providers continue to be responsible for bringing soap and basic supplies so that they can protect themselves. The Venezuelan government reports that they have conducted almost 1.5 million tests. This is a large number. However, upon further inspection, it is evident that the majority of those tests are rapid serologic tests that are not adequate to identify acute infection. These tests actually test for antibodies, and they're a good test to see who has been infected, but it doesn't tell you who is currently infected. And for those who are currently infected, there's a high negative, a lot of these tests are negative because it takes time to develop antibodies. The best way to confirm infection and to see who's infectious at this time, who has the disease, and who could be transmitting it to others is to do PCR tests. Unfortunately, capacity to do PCR tests in Venezuela is limited and is primarily centralized to Caracas. There's also reports of significant delays in getting those test results back, which limit clinical operations and the public health response. So what does this really mean? This really means that the reported cases, the 16,571 cases reported, likely are an underestimate the real impact of COVID-19 in Venezuela. Physicians are telling us that they are seeing classic clinical cases of COVID-19 in hospital and outside the hospital, but are unable to document these cases as COVID-19 because they are penalized unless the case has been confirmed by PCR. But as I said before, PCR capabilities are so limited that many of these cases never had that confirmatory result and therefore are not counted in official documents. This is the same for deaths that clinicians feel are consistent with a COVID-19 presentation and attributable to COVID-19, but again, unless confirmed by PCR at the time of death, cannot be counted in this report. Given hospital capacity and limitations in the ability to provide tertiary care, there is no doubt that the mortality of COVID-19 is higher than the reported 0.9% fatality rate currently reported. The other important issue is the management of people who are returning to Venezuela. People who are returning to Venezuela are considered to be potentially high risk for COVID-19 infection and transmission in the community. The current protocol requires that people who return from Venezuela are tested with these rapid antibody tests, which, as I mentioned before, have a high rate of false negative. People who are negative are then asked to quarantine for 2 weeks in very, very crowded conditions. But because these tests could be a false negative, what this effectively means is that people who are potentially infected but had a false negative test are placed together with people who truly are negative. And that placement of people together under very unsanitary conditions and in close quarters is likely leading to increased transmission among returnees, and that, of course, can exacerbate the situation for them as well as for ongoing transmission in the community. The other issue that is critical is that there is continued lack of protective gear for healthcare workers. Médicos Unidos has been trying to track healthcare worker COVID-19 infections as well as deaths, and by their account, there have been over 30 healthcare workers who have died of COVID-19 by clinical criteria. There is a critical need for data and an independent assessment. there's a need for increased testing capacity, but even without that, there could be an assessment of mortality and comparison of mortality now compared to last year, as well as stratified by age, by gender, and location. The reason for this is because it is critical to have clear data to understand what's happening so that a response can be mounted that really helps the Venezuelan people without any politicization of this assessment or of the aid that's provided. Thank you very much.
Thank you very much, Kathleen, for this sobering presentation. And I now give the floor to Celine Soto of Women's Link Worldwide. Celine, you have the floor.
Good afternoon. Thank you for the introduction and thank you for the invitation to be part of this important discussion. As mentioned, I'm an attorney at Women's Link Worldwide, which is an international organization that uses the power of law to bring women and girls closer to justice. And we have been working with women rights organizations in Venezuela to visibilize the impact that the humanitarian crisis is having on women and girls, and that has essentially put them back in time, facing situations only comparable to the 19th century. What I'm going to do in my presentation is to build on the picture that Dr. Page just described regarding the rights of women and girls. And in doing this, I want to refer to the situation in an emblematic public hospital in Caracas that is called Maternidad Concepción Palacios. This hospital used to provide prenatal care and sexual and reproductive health services for women, not only in Caracas, but from all around the country. And now, due to the impact of the humanitarian crisis and before COVID-19, it's currently operating at half of its capacity and facing the lack of medical supplies, medications, cleaning supplies of all types, and constant interruptions of basic services such as water and electricity. There are days in this hospital in which there is no water service at all. And both the medical staff and patients, including women in labor, have to face the risk of these conditions. Also, when women suffer from an emergency during childbirth, the hospital doesn't have enough blood for transfusions. Last year, the main elevator in the hospital was broken, so women in labor either had to use the stairs or the elevator designated for medical disposals and garbage. In less than 6 months, 265 newborn babies died in the hospital, and in 4 months, 15 women died in the hospital in these conditions. For years, the medical staff has consistently demanded for better conditions in the hospital, but their claims have not been heard by the state, and instead they have faced retaliations and harassment by the government. Because of the seriousness of the situations in the Maternidad Concepción Palacios, last year on March 2019, the Inter-American Commission on Human Rights issued precautionary measures in favor of the hospital at the request of Women's Link and 4 women rights NGOs in Venezuela. The decision of the Commission is emblematic for 2 reasons. First, it recognizes precisely that the humanitarian crisis in Venezuela is putting women, especially those in poverty and newborn babies, in a specific risk because they don't have access to the specialized healthcare they need. And second, the Commission issued specific orders to the Venezuelan state regarding the situation in this hospital, including that any response to address the collapse of the public health system in the country, including the humanitarian response, must prioritize the situation in this hospital as a way to address the severe impact that women are suffering within the crisis. Up until now, more than a year after the decision was issued, the Venezuelan state has not given any response to that order, and the situation in the hospital continues to be of severe risk and even worse with the current context of COVID-19. The situation in the Maternidad Concepción Palacios reflects the reality of women in Venezuela, especially pregnant women and those in need of specialized health services through the country. And this situation is so serious that it's also connected to the reasons why women are forced to migrate to other countries in the region to obtain the medical care they need. In many situations, this decision is actually about to live or die if they stay in Venezuela. It is also important to take into account that these situations are part of a larger context that took place before the crisis and before the COVID-19, with specific enabling factors for these impacts that we're now seeing. Just to mention, lack of public policy on sexual and reproductive rights, restrictive legislation on abortion, non-existent institutional response with regards to women's rights in general, and efforts in overcoming teen pregnancy and maternal mortality have been for years insufficient and also not properly addressed. All of these problematics have been of a special concern for many human rights international bodies and mechanisms. Just to give an example, in 2014, the last periodic review regarding Venezuela carried out by the CIRA committee highlighted specific recommendations to the state to address the permanent increase of maternal mortality in the country, which by the time was so very serious. Another specific concern was the lack of access to contraceptive methods in the country and in general to family planning options. Also, the 2019 report of the High Commissioner of Human Rights regarding the situation in Venezuela raised concern over the situation of sexual and reproductive health services, maternal mortality, and even highlighted the information showing that in several cities in the country, there are 100% shortage of contraceptive methods. This is the result of lack of political and institutional will to effectively protect women's rights that has caused major setbacks that were never seen before. The Venezuelan state has consistently breached its obligation regarding gender-based violence and discrimination against women. So today, Venezuela has one of the highest rates on teen pregnancy and maternal mortality in Latin America. And at this point, I also want to highlight that we know this in spite of the state blocking access to any kind of official information, but specifically on issues like maternal mortality. 2017 was the last year that the Ministry of Health released its epidemiological report that actually showed that in 1 year, maternal mortality increased 66%. A few days after this information was released, the minister was removed from her position. Medical staff and human rights defenders in the country face serious risks when trying to document and have access to this kind of information that should be publicly available and is crucial not only to understand the dimension of the crisis, but also to formulate adequate responses. The state has also implemented concerning response during the crisis with regards to reproductive rights. We have documented that at least from 2015, the state has been promoting sterilization procedures as the only available option within this context of lack of access to family planning methods that is free of charge at the expenses of the state, that is offered only to women and specifically targeting poor women in the country. As I mentioned, there is no official information available to understand the basis for this policy or the results of it. But what we do know is that, for example, women are identified to be part of this program using the ID card that is called Carnet de la Patria, which is being used as a mechanism of political and social control in the communities. And women are also offered the sterilization procedure along with access to other social programs, such as the food program that is called CLAP. And now with the pandemic of COVID-19, of course, the situation is even more serious, as it was described by Dr. Page. And I think Luis will talk a little bit more about the general context. But I'd like to say that another important failure of the state to address a specific impact on women and girls in this crisis, that is actually a crisis within another crisis, is that if anything, is only prioritizing the attention to COVID cases. At Women's Link, we have been insisting that based on the obligations that the states have regarding the rights of women and girls, sexual and reproductive health services must be a priority in the response to the pandemic, because with or without COVID, women will continue to need these healthcare services. If they are denied, there is not only a form of discrimination and gender violence against women, but it's also a specific risk for them and their lives. So I'll finish my presentation by saying that women and girls need to be at the center of the response to the humanitarian crisis in Venezuela, that the specific risks and impacts they are suffering need to be part of the discussion. And we know that one of the areas that is extremely urgent that it's given proper attention is the situation of sexual and reproductive rights. If not, not only half of the population will continue to be left out of the response, but also Venezuelan women will continue to face risk to their lives and will continue to be far away to having access to their rights. Thank you very much.
Thank you very much, Selena, for your presentation. Again, lining out the fate of women in particular in this crisis. Unfortunately, when you look at crisis areas worldwide, it is all over the place that women are those suffering most, and under COVID-19, it is again the fact. I now give the floor to Luis Charbonneau of Human Rights Watch.
Thank you, Ambassador, and special thanks to both you and the Ambassador of Dominican Republic for organizing this important event, and to everyone else who's following today, and my fellow panelists, Dr. Page and Selena. Before I speak, we have a few slides I'd like to ask that the hosts now show. So these are very recent images. They speak for themselves, so I'll let you take them in. So it's important to consider the fact that Venezuela has become a police state, and this has become even clearer during the COVID-19 pandemic. COVID-19 has provided a perfect excuse for the authorities to crack down on critics and opponents. The decree by President Maduro that established a state of emergency and alarm, as it was described, authorizes security forces to carry out what they call inspections whenever they deem necessary, if there is, quote, a reasonable suspicion that someone is violating the decree. In practice, quarantine measures have been enforced by the armed forces, the police, including the Special Action Force, the FAES, which has been implicated in extrajudicial killings, and armed pro-government gangs known as colectivos, which collaborated with security forces in the crackdowns in 2014 and 2017. The Office of the High Commissioner for Human Rights reported in July about the discretionary implementation of the state of emergency by the military, law enforcement, and local authorities. The OHCHR has documented as well that colectivos have intimidated and attacked political opponents, demonstrators, and journalists before and during the pandemic, and implemented lockdown measures in poor neighborhoods. Similarly, local groups documented that security forces have arbitrarily detained people for not using face masks or gathering in groups on the streets, and colectivos have beaten and tortured civilians for allegedly failing to comply with quarantine measures. Authorities have harassed, detained, and prosecuted political opponents, including several legislators, journalists who publish critical information, health workers who criticize the government's handling of the pandemic, and human rights lawyers who provide legal support to demonstrators protesting limited or no access to water, gasoline, or medicines. Security forces have also confiscated cell phones and laptops from journalists and forced them to erase photos or videos. This makes it much harder to ensure an adequate response to the pandemic and Venezuela's humanitarian situation more generally. So what to do? It's essential that we separate the political struggle regarding who's in power in Venezuela from efforts to bring international humanitarian aid into the country. Experts from Human Rights Watch and Johns Hopkins Centers for Public Health and Human Rights and for Humanitarian Health are calling on UN Secretary General Antonio Guterres and UN Emergency Relief Coordinator Mark Lowcock to take charge of efforts to address the humanitarian situation in Venezuela and to request that the Maduro government adopt all necessary measures to ensure that aid effectively reaches the Venezuelan people. The UN, the US, the EU, the Lima Group, and countries with demonstrated influence over Venezuelan authorities should press them to open Venezuela's doors to a full-scale UN-led humanitarian response that reaches the interior of the country, specifically by allowing full access to the UN World Food Program and its partners, which have the logistical capacity to provide a significant amount of aid nationwide. They need to enable local and international humanitarian workers to provide aid and have access to all hospitals and other healthcare centers so they can provide supplies and assistance in the pandemic. They should allow healthcare professionals and humanitarian workers to carry out their work without reprisals and ensure that they can move freely throughout Venezuela despite quarantine restrictions by issuing and respecting special permits and by prioritizing their access to gasoline. And they should allow independent experts to review and publish all epidemiological data to increase transparency about the extent of the humanitarian emergency by reporting accurate counts of COVID-19 confirmed cases and deaths, and by resuming regular publication of detailed mortality and morbidity reports. This is something that Dr. Page mentioned, and we can't emphasize it enough. All governments should fund UN-led humanitarian efforts that comply with the UN standards of humanity, neutrality, independence, and impartiality in the provision of assistance. A word about sanctions. Given the risk of overcompliance with US financial sanctions and sanctions on Venezuela's oil sector, as well as Venezuelans' need for resources to address the humanitarian emergency, the US government should make it absolutely clear that no one will be penalized for financing or supplying humanitarian aid to Venezuela in this time of a public health crisis. And they should make it doubly clear that humanitarian aid is exempt from sanctions. They should limit overcompliance, including by publicly providing concrete avenues for companies and organizations to channel humanitarian aid into Venezuela without excessive bureaucratic scrutiny or delays. And they should actively support a robust UN-led humanitarian effort in Venezuela. And that goes for the entire world. Now to the Pan American Health Organization, PAHO agreement. Venezuela's health minister, Carlos Alvarado, and the National Assembly's health advisor, Julio Castro, signed an agreement on June 1st to coordinate efforts to obtain international funding to strengthen Venezuela's ability to respond to the pandemic. They also requested technical and administrative support from PAHO, which, as was said, is a branch of the United Nations. This welcome agreement has the support of both the government and the opposition. It sets out the following priorities: detecting COVID-19 cases, providing adequate and timely treatment of confirmed cases, providing supervised isolation of symptomatic cases and quarantine for people with whom they were in contact, protecting healthcare workers, putting in place preventive and infection control measures in health facilities, providing epidemiological monitoring, information analysis, and situation reports, and communicating risks to the public to ensure they can adopt preventive measures. The agreement does not specify how the delivery of aid will be implemented or monitored. Since PAHO and other UN agencies with a presence in Venezuela will be unable to fully monitor implementation across the vast territory of Venezuela, the government should ensure that UN agencies and international and local non-governmental organizations face no obstacles in monitoring the deal. Proper implementation and monitoring of this aid and its delivery will be essential. In conclusion, we have an opportunity to drastically improve the situation on the ground and fight COVID-19 in Venezuela. But the government needs to stop its repression. It needs to allow independent third parties to help gather data and communicate it, communicate with the opposition, and open its doors wide open to the UN. The UN needs to take charge of the situation and do everything it can to improve it. And UN member states need to give the UN leadership the political and financial support it needs to make a difference in Venezuela. The alternative is more unnecessary sickness and death. I urge you all to make the right choices here. Thank you.
Thank you very much, Lou. This is how we know you. Political demands and international community has to engage. I think this was. I think I speak in the name of everybody. This was a very good presentation with regard to the health situation, the hospital situation, the situation of women, and then the political aspect. So thanks to all of the three briefers. I think you gave a very good overview over the difficult situation. We now want to go to the audience. The audience consists, and we are very happy and we are surprised by so many people who are interested in this debate. We have member states, we have UN agencies, we have civil society representatives, media. Now, in the Security Council, we always are very well organized with a list of speakers and one after the other, sometimes a bit boring. Here, I think it will be more lively, I hope at least. But forgive us if we do it, if we don't get everybody in the right following up one after the other. What I suggest is the following, that you either use the raise hand button. For those who don't know where it is, there's an alternative, and that is go into the chat room and say that you want to speak. When you speak, please present yourself and be short. Everybody else who is not speaking, please don't forget to mute yourself. So, having said this, I invite you, to ask questions to the panelists, make comments, and feel free. Don't be shy. In the Security Council, when you say this, everybody wants to speak. So we have Daniel Almeida from CARE International. And so I already introduced you. Daniel, you have the floor.
Good morning, and thank you for that very compelling presentation. I will be very brief. My question, and thank you for introducing me. I am part of the regional team for CARE International in Latin America. And thank you for the colleagues for the presentation. This is very a really burning and relevant topic. It's going to support some of the effort we're doing from the civil society in the region. My question goes to Mr. Charbonneau, and it has to do with, I would like to hear a bit more on the call that you're making for allowing humanitarian access to different actors under a UN-led type of intervention or initiative. I would like to hear from you, how do you see this happening in the following months in the near future? What do you think is holding this permission for humanitarian actors to forward, and what will be your immediate recommendations on that front? Thank you very much.
Thank you very much, Daniel. And now I give the floor to Karen, the DPR of Belgium.
Yes, thank you so much. Christophe, you already presented me. So I want to thank you and the Dominican Republic for organizing this meeting, and of course the briefers for their quite sobering interventions. As was described, the humanitarian situation in Venezuela, which is entirely a man-made one, is dramatic and is causing an exodus of the country and risks also to destabilize the region. And we do regret that the Security Council until now has not been able to play an effective role with regard to that situation. It's very worrisome. The situation is very, very worrisome, and we support the SG and its call upon the government authorities to engage with the UN and humanitarian organizations to facilitate humanitarian assistance. I want to stress, as also Jose did, that we need to depoliticize assistance, and that we need to stress the importance of full and unhindered humanitarian access. There was also a reference to sanctions. Of course, it were the American sanctions, but I want to briefly touch upon the European ones. Europe has also sanctions, but Europe is also the largest donor to the Venezuelan humanitarian crisis, providing more than half of all funds. And I just wanted to point it out that European Union sanctions are targeted against specific individuals responsible for grave human rights violations. And they are specifically designed not to affect the population. And then I have one question. So I would like to ask the briefers, how do they see the role that the UN now is playing, and how the regime gives the possibility to the UN to play that role, to give the humanitarian assistance following and respecting the humanitarian principles. Thank you so much.
Thank you, Karen. And I'd like to give the floor to the US mission, Jason.
Thank you very much. On behalf of the United States, I'd like to thank both the German and Dominican Republic missions for organizing this important event that rightfully shines a spotlight on the growing and dire humanitarian needs of millions of Venezuelans. We also thank the researchers of Johns Hopkins University, Women's Link, and Human Rights Watch for their briefings and impactful images highlighting concerning trends in Venezuela. We note that earlier this month, the United Nations Office for the Coordination of Humanitarian Affairs released the 2020 Humanitarian Response Plan for Venezuela, as well as the updated Global Humanitarian Response Plan for COVID-19. With the Johns Hopkins and Human Rights Watch reports, the 2020 HRP, the GHRP, and ongoing assessments produced by the interim government of Juan Guaido, the world has a clear, if profoundly disheartening, understanding of what Venezuelans endure under the neglect and oppression of the illegitimate Maduro regime. The United States is deeply concerned about the 9.3 million people in Venezuela suffering from malnutrition and in need of assistance. The US government's assistance to Venezuelans inside and outside their country totals $856 million, and we remain the single largest donor to this humanitarian crisis. While many of our international donor partners have been generous in contributing to this humanitarian response, the needs continue to outpace available resources. We strongly encourage continuing contributions from international donors, and we also encourage the UN humanitarian organizations to continue seeking out a greater diversity of donors. The United States is concerned at the numerous operational challenges for humanitarian organizations, as the Maduro regime has made it extremely difficult for international non-governmental groups to register in Venezuela legally, and for foreign humanitarian workers to receive visas. These bureaucratic constraints, coupled with logistical impediments and security concerns, makes it difficult for humanitarian organizations to respond at a scale commensurate with the needs created by this man-made crisis. We are also concerned about the intimidation of medical professionals and journalists as they seek to respond to and report on the scope of the pandemic in the country. The US government insists that the Maduro regime provide full and open access to humanitarian organizations to allow them to deliver impartial, transparent, and timely aid to those most in need. The American people will continue to support Venezuelans during the humanitarian and economic crises caused by the Maduro regime and the rapacious activities of members of his illegitimate regime. The United States urges other nations to continue to do the same. My question to the speakers today is the following. Do you have any updates on the harassment and intimidation of medical professionals and journalists working on addressing the pandemic, as noted in your report? Thank you.
Thank you, Jason. And I want to go back to civil society and then to Russia. First, Selina Mendoza, perhaps you can introduce yourself and your organization, and then afterwards the Russian representative. Selina. You have to unmute yourself.
I'm sorry, got it. So I'm Celia Mendoza from VOA. Latin America. And I actually have a quick question, just in terms of how the process of getting the Secretary General to push a little harder. Lou was talking about being able to go into the interior of the country. Venezuela has a lot of regions that have not been able to be attended, and that's one of the biggest questions that a lot of people have, because Caracas is the center and maybe Maracaibo and some of the border towns. And then the second part is in which way will the international community will be able to pressure for that? We'll be talking about a dialogue. We know the Norway Senate team just last week to Venezuela. Will they be working in a possible deal? It's just a question in terms of if that will be one of the scenarios. Thank you.
Thank you, Celia. And now I give the floor to Russia, Yevgeny.
Thank you, Ambassador. I just would like to apologize first of all that I will not be brief because we would like to shed a light on the real state of affairs in Venezuela. We feel it necessary since many of you are not fully aware of the Security Council closed consultations on April 28 on this very topic, humanitarian situation in Venezuela amid pandemic. That April event was proposed by organizers with the sole purpose to respond to an earlier discussion initiated by Russia on the attempts to use the situation with the pandemic to increase political and military pressure on the legitimate government of Venezuela. And that is exactly what is happening today again. Distorting facts, politicizing and weaponizing pandemic and humanitarian situation as a whole became a sorrowful trend within and around the United Nations. Since there is a call in the concept note to raise awareness and analyze, and from you, Ambassador, as well, let us get straight down to the facts. We already heard figures, last figures about the cases, confirmed cases of COVID-19. There are more than 60,000 and more than I think around 150 deaths. That is out of 8.5 million of cases and 337,000 deaths in the Americas, in all countries of Americas, according to the World Health Organization. In the region, Venezuela ranks 15 out of 35, with 0.16% of all confirmed cases in Latin America. To be frank, these numbers are still a drastic increase since the Council discussion in April, when there were only 325 confirmed cases with 10 deaths. Such an increase, however, is natural because Venezuela did not close its borders to thousands of returnees, whose expectations on the security and financial well-being were not met in other countries. It is important to say that as for now, Venezuelan government has carried out almost 1.5 million tests free of charge. That is almost 50,000 tests per million, putting Venezuela among top 5 countries in the region with the highest number of tests. 98% of all confirmed cases of COVID-19 in the country are being treated with the national health system, which is public. So what exactly we're discussing today? Why not we're not discussing the other countries in the region which have much more severe impact of pandemic? Instead, the organizers of this event prefer to focus on what they like to call humanitarian crisis, meaning the challenges that the country faces amid pandemic. But let's be honest, COVID-19 created or revealed challenges in every single country across the globe. And so what's the difference with Venezuela? I will tell you that the difference is where those challenges stem from. Since 2014, the Venezuela and Venezuelans face enormous financial pressure caused by unlawful sanctions. And some of the colleagues already mentioned this. 58 various restrictive measures imposed by the US, 8 by the EU, 5 by Canada, 2 by Lima Group, 2 by Panama, 2 by the UK, and 1 by Switzerland. We, of course, heard the arguments of European countries and that the European measures are targeted on the individuals and allegedly do not hinder humanitarian needs. but we think this is simply not true. Needless to say that in addition to its own sanctions, EU and its financial entities support and implement US sanctions. Let me give you some facts. In April 2019, frozen Venezuelan assets and transfer bans for 4.8 million euros did not allow to pay for urgent transplantation surgeries in the Italian hospitals where Venezuelan patients died, including 2 children. The concept note as well does not mention that it is due to unlawful sanctions that the Venezuelan health system is unable to get a necessary amount of equipment and medicines. As a result, 300,000 Venezuelan lives are under threat, including 80,000 with AIDS, 16,000 who need dialysis, another 16,000 in urgent need of anti-cancer treatment. 4 million diabetics depend on foreign supplies of insulin. All of that could have been delivered and paid for by the Venezuelan government. In the meantime, in February 2019, upon request of the US, Portuguese bank frozen $1.7 billion. In March 2019, Belgian institution frozen $34 million. In April, a French bank frozen $34 million, while the Bank of Liechtenstein frozen $21 million. I'm not even mentioning the infamous decision of the Bank of England on the Venezuelan gold reserves, which forever undermined credibility of the reputable financial institution. By the way, German institutions blocked 38 million of Venezuelan assets, which could have been used for healthcare as well. So overall financial damage to the country amounts to $116 billion. The facts that I stated make it clear that the position of some countries which introduce or support unlawful sanctions and then try to arrange discussion on the humanitarian situation is nothing but hypocrisy. The latest example is that a number of countries within the United Nations blocked the decision to allow the Venezuelan government to make a necessary payment to the UN budget, despite the country has enough resources for that. As a result, Venezuelan delegation lost the right to vote, and instead of listening to the official position, UN members are being offered an official side event with no representatives of Caracas even present.
To end because there are so many speakers, and it's not fair to monopolize the discussion.
Sorry, Ambassador, just one last issue I would like to point out about the agreement with the support of PAHO. I would like to state the fact that PAHO is not the branch of the UN. This is intergovernmental organization which has the mandates on behalf of WHO to represent WHO in Americas. So just I would like to point this fact. Thank you, Ambassador.
Thank you, Jenny, for your contribution. I now give the floor to Lizzie Flores and afterwards to Miguel Pizarro. Lizzie, you have the floor. You have to unmute yourself and please set an example with regard to the length. Thank you, Lizzie.
Thank you. I'm Mary Elizabeth Flores, the representative of Honduras to the United Nations. And thank you, Christoph and the German mission, and also Ambassador Singer and the Dominican Republic mission for organizing this urgent conversation and inviting us to participate. And thank you, panelists, for the clear picture you painted on what is occurring in Venezuela. It is heartbreaking and of much concern, all the conditions, the horrific conditions that the usurper tyrannical regime maintains. And we must do everything we can as an international community at different levels, the UN system, at the regional level, and even states, and all the active members that are committed to human rights to get the people of Venezuela the urgent care they need, the support, the equipment, the tools to have access to all they need so they can be safe, so they can protect their families, and so they can strive for a better livelihood. So thank you very much.
Thank you very much, Lizzie. It's wonderful to see you here. Thanks for your contribution. And I give the floor now to Miguel Pizarro. Perhaps you can introduce yourself.
Thank you, Your Excellency. I am Miguel Pizarro. I am member of the Venezuelan National Assembly, and also I am the commissioner for the United Nations system of the interim government of Juan Guaidó. First of all, I want to say thanks to the diplomatic missions of Germany and Dominican Republic for organizing this event, and also to all the panelists and the representatives for participating in this event. Since 2015, Venezuela has been going through a complex humanitarian emergency, which affects more than 7 million people, which has led more than 5 million Venezuelans to become migrants and refugees in a lot of countries in the world, which has caused more than 9 million people, 1/3 of our population, are right now living under food insecurity. And almost 60% of the country doesn't have resources to buy food or the basic needs. In March, COVID-19 was added to all of this. And now Venezuela, as Human Rights Watch has said before, Venezuela is an emergency in the midst of a broader and bigger emergency. Spaces like this should not only lead to make the problem visible, I think also these kind of spaces should be used to make concrete proposals and to take measures that allow us to stop what is happening in my country right now. This week, the final stage for the cooperation with PAHO and IFRC under the technical agreement between the parts was concretized in order to attend and protect doctors, specialists, nurses, and all the frontliners who are fighting against the pandemic. This is a small but significant step towards scaling up the humanitarian response in the country. However, it is also necessary to make efforts for this response to be expanded. It's necessary to increase the access, to fight and to press for more access of international organizations and agencies to the country. It's necessary to increase the humanitarian response plan financing and the intersectorial plan to face COVID-19. And it's also necessary to keep all the pressure and all the lobby to allow the World Food Program access to Venezuela, not only to contain the food crisis, also to help in the logistics. In addition to these 3 points, I think that the most important thing that within the UN should be discussed is that not only address the consequence, we should also address the real cause and the root cause of all of this, that is the political breakdown and what is happening with the regime inside of my country. What is happening in Venezuela today needs the attention of multilateral organizations, agencies, and countries, because otherwise it will continue to escalate and to be not only a threat and a problem for my people, for the Venezuelans, also for the region and the hemisphere, because the humanitarian emergency is only going deep and deep. Thanks, Your Excellency, and thanks to all the state members for being part of this event today.
Thank you, Miguel, for your contribution. I now give the floor to representative of China, followed by the UK. China, you have the floor.
Thank you, Ambassador, for the floor. I listened carefully to the briefing by the panelists, and I'm particularly interested about the COVID-19 aspect briefed by the panelists. Actually, that every country is coping with this COVID-19 health crisis, not only Venezuela. And Venezuela actually did better than a lot of countries according to World Health Organization and PAHO. The only difference is that I think that our Russian colleague has mentioned is that Venezuela is under very serious unilateral sanctions. And under these measures, I think that Venezuela is cut from the access to international trade, and their national assets were freezed, which should have been used to procure medical goods, PPE, energy, and foods. Actually, Venezuela has the ability to cope with this health crisis, to cope with COVID-19 pandemic, but its ability is severely damaged. So I would like to ask and invite all audience to help me reflect on this question, is that what can we do to convince those who impose unilateral sanctions to separate the political fight in Venezuela from the humanitarian response, to let humanitarian response be humanitarian response? Thank you.
I thank the representative of China, and now I give the floor to the UK. Alice, you have the floor.
Thank you very much, Chair, and thank you to the missions of Germany and Dominican Republic for this initiative, and also to the briefers today for setting out the scale of the challenges. I will keep it brief. COVID-19 is clearly aggravating an already deteriorating humanitarian situation that predates COVID. We highly commend the UN agencies and NGOs for rapidly scaling up their support over the last year, despite a very complex operating context. The UK has provided over £44 million in response since January 2019, primarily on health, water, sanitation and protection. And in fact, 80% of our aid is directed inside Venezuela to relieve immediate suffering. As like other colleagues here, we would also urge other donors to support the UN appeals, and I would particularly add to think especially about the balance of support inside Venezuela, as well as to the broader regional response. As I mentioned, the UK directs 80% of its aid inside Venezuela. Thank you very much.
Thanks, Alice. And I now give the floor to the Deputy Permanent Representative of Guatemala and afterwards the representative of Switzerland. So, Omar Castaneda, you have the floor.
Thank you very much, Ambassador Huisgen and Ambassador Singer. We are very grateful for convening this important and relevant meeting and for this initiative. I'll be brief as well. We also want to thank very much and our respect goes also to the briefers for their very detailed presentations, particularly by Human Rights Watch and Johns Hopkins University. The presentations are clear and we have seen the dramatic and destabilizing situation in Venezuela. The humanitarian situation is extremely concerning, it's dramatic, and certainly something that we have voiced many times. We again deeply regret the situation that our Venezuelan people are living nowadays, and certainly in light of this pandemic, it is our hope that the Security Council also will take the needed measures, and of course will be appraised about the situation, taking into account that the humanitarian situation is even more dramatic in the country. Again, thank you very much, Ambassador, for convening the meeting to both of you. Thanks.
Thank you very much for your contribution. I now give the floor to the representative of Switzerland.
I hope you hear me. Thank you very much. I will be brief. I just wanted to give a message about Switzerland, what Switzerland does in Venezuela. I'm the humanitarian focal point here at the Swiss mission in to the UN in New York. So since 2017, the Swiss humanitarian aid has focused on the most urgent needs, such as health, nutrition, protection, education, food security, and better access to water and sanitation. It does it through its multilateral partners, of course, NGOs, international NGOs, and also through our Swiss humanitarian aid unit. Last month, we facilitated the transport to Caracas of 94 tons of mainly medical material from multilateral partners and various Swiss and international organizations, making, we hope, an important contribution to the fight against COVID-19. And since May 2019, we have a cooperation attaché that is in Caracas, supporting to the Swiss embassy for overlooking and try to better implement the Swiss humanitarian commitment to the ground in order to ensure an effective and rapid response to the massive influx of Venezuelan migrants and refugees in the region. Switzerland is also supporting Colombia, Peru, Ecuador, and Chile under the roof of the Regional Intervention Plan of Refugee and Migrants. However, the exodus from Venezuela can currently only be reduced by restoring access to the basic needs of the Venezuelan population in the country. Switzerland therefore encourages all humanitarian actors, and in particular donors, to continue the support for the people of Venezuela. It welcomes the effort of the UN to coordinate humanitarian action, especially the HRP 2020 for Venezuela. Its successful implementation requires sufficient funding from the donor states and guaranteeing access by the Venezuelan Authority for humanitarian actors, which is a difficult point. So between 2017 and 2019, Switzerland has mobilized almost 24 millions and plans to mobilize around 12 millions of Swiss francs for 2020 to support the humanitarian response in Venezuela and in the region. So finally, Switzerland is committed to making the situation in Venezuela and the migration crisis in the region more visible at the regional and international level. We are therefore actively involved in regional and international coordination activities, such as the Quito process. We are a member of the group of Friends of the Quito process, and we participate in the regional coordination platform of the UN agency. And we hope that all states will move forward for doing the same. Thank you very much.
Thank you. In the chat room, there was Joseph Donnelly from Caritas made a comment. I don't know if you want to say a word. Otherwise we go to the St. Vincent and the Grenadines. But first, Joseph Donnelly, you want to take the floor? That seems not the case. So he made a remark in the chat room, and then I'll give the floor to the representative of St. Vincent and the Grenadines.
Thank you, Chair. At the outset, St. Vincent and the Grenadines wishes to thank the organizers of this event for their invitation. We also take this opportunity to reaffirm our solidarity with the government and people of Venezuela under the leadership of its legitimate President Nicolas Maduro. Today's high-level side event emerges against an undeniable truth. The COVID-19 pandemic is wreaking havoc across the globe, and it is sparing no country in its onslaught. The region of Latin America, recently declared as the new epicenter of the pandemic, and where countries have been grappling with structural inequalities of a lopsided international system in which unbalanced global development undermines resilience and accentuates vulnerabilities, must unite, redouble its efforts, and leave no stone unturned to frontally tackle this pandemic. Accordingly, my delegation is disappointed that today's event was convened with a special focus on Venezuela. It would have been more appropriate to have a candid discussion on tackling the COVID-19 pandemic in the region of Latin America, the new epicenter. More importantly, data from the World Health Organization reveals that Venezuela is not amongst the leading countries of COVID-19 in the region. Undoubtedly, Venezuela, like so many countries throughout the world, is facing humanitarian challenges which are further complicated by the pandemic. We therefore do not believe that a jaundiced approach is necessary, especially since the government and opposition have already demonstrated their willingness to unite in combating the pandemic by agreeing to allow financial contributions in humanitarian aid to be delivered to the Venezuelan people apolitically through the Pan American Health Organization. Whilst we recognize the laudable efforts between the government and opposition in casting aside political and ideological differences to combat the pandemic, we believe the international community should be more responsible in accompanying these efforts. In this respect, St. Vincent and the Grenadines reiterates that the humanitarian situation in Venezuela cannot be divorced from the illegal, unilateral, extraterritorial, and coercive sanctions imposed on this sister Caribbean nation. On one hand, there are repeated calls to address the humanitarian situation in Venezuela. Yet on the other, a deafening silence reverberates when there is a call to lift the illegal unilateral sanctions. As we commend the Venezuelan government and people in their efforts to respond to the complexities of the COVID-19, as well as the concomitant migratory challenges, we also renew our call for the lifting of the economic blockade to alleviate the suffering of Venezuelans. We reiterate our support for the calls of Secretary General Guterres and High Commissioner Bachelet for the lifting of unilateral sanctions and the cessation of hostilities in order to save lives, protect health personnel, and reduce the transmission of the disease in the country. We remain steadfast in our view that economic asphyxiation will only create undue hardships and exacerbate the already great suffering of the people of Venezuela and, by extension, Latin America. Finally, we encourage all well-intentioned actors interested in supporting the people of Latin America to refrain from politicizing humanitarian response. The international community, now more than ever, needs to be more united, cooperative, and robust to address in a systematic manner the health, socioeconomic, political, and security risks associated with the COVID-19 pandemic. St. Vincent and the Grenadines reaffirms its support of the World Health Organization's key coordinating role, which ensures effective epidemic preparedness, prevention, and response within the framework of the international health regulations. I thank you, and I only have one question. And my question is similar to that posed by the delegation of China. How has the imposition of unilateral economic sanctions affected countries' abilities to respond to the pandemic? Thank you, Chair.
Thank you very much. And before now going back to the panelists, just let me make one remark, because it was addressed to the organizers, or two remarks. First, our intention was indeed not to politicize it, but to concentrate on the humanitarian situation. Now, why? Because our colleague from St. Vincent Grenadines, I think also before the Russian colleague said, well, why picking Venezuela? The reason is that going into COVID-19, Venezuela already had, I believe, the most dire humanitarian situation on the continent, and COVID-19 has even aggravated it. And hearing from the briefers, I believe the situation is really bad and in the country, and therefore. But Germany, for instance, would participate if you or others organize other events on humanitarian situations. Germany is one of the largest donor in humanitarian aid, and so we do this non-politicizing. We do this in wherever there is a crisis. We try to help. So with this, I go back. Jose, and then we go back to the briefers. Jose.
Can I just add to that? The Dominican Republic was inspired to co-sponsor this only because of the agreement between the Venezuelan health minister and the opposition-led National Assembly to work together. All we're looking for is for the UN system to get funds to help the Venezuelan people. If somebody wants to take sides and politicize it, that is their problem. That is not our intentions as organizers or Germany's. I can guarantee you that. If you want to take sides and blame white Venezuela, that's your problem. But the intentions are just to pick up from that agreement between both sides to help in the pandemic. Thank you.
Thank you, Jose, for clarifying this. Now, going back to the briefers, we will start from the third briefer, and we go to Lou Chabot from Human Rights Watch first.
Thanks. And a lot of great questions and interesting comments and discussion, not all of which we would agree with, but I'll do my best to respond to some of the key questions that were brought up, and I'll do it very quickly, succinctly. So how to run a UN-led response? The key is getting the World Food Program to have access throughout the country, especially the interior, everywhere everywhere that it needs to go to. Right, that doesn't exist so far. On the level that is necessary and that we could be seeing. The UN has been scaling up. They've done a lot. They've done a lot there, but we need to do more. The PAHO agreement is key, and just to correct something that was raised by the Russian representative, PAHO is in fact part of the UN system. It's the regional arm of the World Health Organization. So it's very appropriate for us to be discussing it here today. So we need to monitor the implementation of that agreement. We need credible third-party monitoring. The key is in President Maduro's hands. So what about the role of the UN? As I said, the UN is scaling up, but it can only do as much as the government is allowing. The UN leadership, in our view, could be pushing harder, and we urge them to do so. But it's also important to remember that President Maduro is the one who holds the keys to the gates. We hear a lot about the politicization of aid. It was his government that began the politicization of aid. And let me give you an example. In 2018, when the government was denying that there was a humanitarian emergency or a problem, millions of Venezuelans couldn't afford to buy food on the open market. There were government-controlled rations that became their only option. But instead of allowing them to be freely available in supermarkets, the Maduro government was using the military and its supporters to distribute them. So if you didn't support Maduro, you didn't get any rations, right? That's politicization of aid. And that's why we need concerted pressure from member states and the UN leadership to make sure that there is an opening up, which we haven't seen yet. Now, in terms of a question that was raised by the US about retaliation, now a state of emergency like we have with COVID-19, it could be a legitimate reason to limit circulation but in a country like Venezuela, where it's implemented by abusive security forces, armed pro-government groups with a record of arbitrarily detaining thousands of people, torturing detainees, committing extrajudicial killings, it's a recipe for disaster. Today in Venezuela, you can't even share information criticizing the Maduro government via WhatsApp, a private means of communication without fear of being prosecuted. In terms of the point raised by the Russian representative, the Chinese representative, and St. Vincent and the Grenadines about the sanctions, we need to remember that the humanitarian emergency in Venezuela predates the sanctions, right? The misery that the Venezuelan people are facing today was brought on by a government that seems to care more about staying in power than feeding its people or helping them deal with COVID-19. That's why we're saying we need to depoliticize aid. We need to focus on saving lives, not propping up a government, right? I think, finally, a point made by the Chinese representative, he was asking or suggesting that Venezuela may have done better than other countries. How do we know that? We don't have credible data from the government. There's no question that the number of COVID-19 cases is higher than the official figures that we're getting. So we can't really be making any statements or assessments of this. It's why we're calling for the resumption of the release of data and third-party monitoring by credible third parties of the collection and the release of the data. Then we can really make plans for combating it. We can do this, and if everyone sort of depoliticizes things, works together, it can happen, and I hope it does.
Thank you very much, Lou, for your remarks and your responses to questions raised earlier. Now, Celine, it's up to you again.
Thank you, Ambassador. I think I will just comment on or insist in the importance of looking at the specific impacts, and especially on sexual and reproductive health services for all the situations that I mentioned in my presentation. I think the last report, or the report issued by OCHA for the humanitarian response in 2020 for Venezuela, clearly highlights the importance to address access to sexual and reproductive health care. So that is one of the most urgent things that we need to be addressed, and also to insist in the agreements that the government made with the High Commissioner of Human Rights last year to give access to the mechanism of the United Nations to the country to document all the human rights violations there. Thank you, Ambassador.
Thank you, Celine. And now I give the floor to Kathleen. Back to you.
Hi, thank you very much. So I think I will focus my comments on the issue that has been brought up, that Venezuela currently has a low number of cases reported and a low number of deaths compared to other areas in the region. However, we must remember that these reports are based on tests. And it's important that two things. One is that the right tests are conducted,
And as I mentioned before, the 1.5 million tests that have been conducted have not been the right tests with a high level of false negatives to really assess what is currently happening. So number one is the right test. The second thing is the right testing strategy. What do I mean by that? I mean by an equitable, non-politicized strategy. What does this mean? It means that doctors can order the test when they need to without fearing that if they're ordering it on some people, they could have retaliations. It means that the test comes back on time so that they can make clinical decisions. And if COVID-19 cases are only going to be reported based on the test result of a PCR, that needs to be accessible to everyone. It also needs to be equitable, not only available to some groups and not to others. For example, in COVID-19, it's so critical to use data to respond, and this is the case in every country. So when we look at cases, we need to know who's affected: women, men, age, indigenous groups, specifically vulnerable groups. The ask really is that the aid is depoliticized, that help that is needed to expand testing capacity, to and then to assess the conditions, and then be able to analyze separately and independently what is really going on, so that the response can be adequate to what we're seeing on the ground. And as mentioned before, I don't think we have a good sense of really the scope of the crisis right now in terms of COVID-19, only to say that doctors and nurses are reporting that they're seeing lots of cases that are not confirmed and are not being counted in these official statistics. And finally, there was a question about retaliation to doctors. And all I can say is that among the doctors and nurses that I have spoken to, they fear documenting in the chart, in the medical chart, when they see a presentation that is consistent with COVID-19 or a death that's consistent with COVID-19 without that PCR confirmation, which again is limited because they fear retaliation. And so that is, in a nutshell, my ask is that to guide the response that's adequate and fair, we need epidemiologic data and all the help from the international community as needed to get testing in place and then to have an independent health assessment. Thank you.
Thank you. Thank you very much, Kathleen, for what you just said. Before Jose will say the finalizing words, let me just make a few remarks. First, to thank everybody for participating, thank everybody for the discipline we got basically through our program, and everybody could say something, ask questions. That was very good. I cannot summarize it, but I try to make maybe 4 points which I take back from this discussion. The first one is, I think that today's discussion again has shown, and also the debate we have had before, and what Jose said, that it's crucial to separate the political struggle regarding who is in power in Venezuela from the efforts to bring international humanitarian aid into Venezuela. Second point, humanitarian actors need unimpeded and sustained access to the most vulnerable people and must be able to deliver humanitarian assistance. I think Lou, you also said how important it is that World Food Program actually has access to all regions. And humanitarian actors need to be, and their delivering of humanitarian assistance has to be in full accordance with the principles of humanity, neutrality, impartiality, and independence. And I think everything, Kathleen, you said on what is asked is basically what these 4 principles ask the authorities to do. And I would like to specifically include in what needs to be delivered is what Celine said with regard to sexual and reproductive health. Again, as I said at the beginning, but women are in these conflicts usually those ones who suffer most. Third, humanitarian assistance must never be exploited for political purposes or misused as a propaganda tool. And unfortunately, we heard some examples of how that is used. Politicization of the delivery of humanitarian assistance runs counter to the humanitarian mandate and also undermines the safety and security of humanitarian workers. And the fourth point, we call, instead of politicization, propaganda, we call for a united attempt to combat COVID-19 that includes all political actors. And in light of the pandemic, it is more important than ever to achieve strength through unity. The international community must not and will not leave the Venezuelan people alone. So thank you very much from our side. It was a really pleasure for Germany to participate in this, and it is for our presidency, where we had human rights, humanitarian issues, health issues on our agenda from the very first day. It's for us also very positive, if I may say so, that we end our presidency basically with this event today. Jose, you have the final word.
Thank you, Christoph, and let me take the opportunity to congratulate Germany for their excellent presidency during the month of July. And I know I sit in the Security Council, but call me naive. Our intentions, I can guarantee you, as I repeated before, you know, the Venezuelan opposition and the government usually don't agree on anything. They agree on this help. Let's channel it. Let's help them. That's what they need. Let's go through the UN system. That's the right way. Let's unite efforts for that. That's my message. And I do want to thank the briefers for their information they administered, and everybody who spoke their mind. Thank you for being interested in Venezuela is a brother country to the Dominican Republic. Never forget that. Never forget that. Thank you.
Thanks, everybody, and have a good afternoon. Thank you all for participating. Bye-bye.